Hello, everyone. Before I start this talk, I'd like to thank the Hemophilia Society of Ontario for inviting me to share my thoughts on the occurrence and relevance of musculoskeletal bleeds in women with bleeding disorders. I use the term relevance because most of the time when we think about women with bleeding disorders, we always talk of menorrhagia and gynec problems, childbirth, etc. But women with bleeding disorders also suffer from musculoskeletal bleeds. They do suffer from chronic pain and may have mobility issues. So it is an important area of problems in this group that definitely needs addressing, screening, assessment, and a sort of planned management. So, the first thing I'd like to say in this talk is that women can bleed into their joints and muscles too. So, asking questions about whether, a woman's with a bleeding disorder has pain in their joints, swelling in their joints, whether they have stiffness in their muscles is a very important and relevant question when we meet them and we are trying to assess their problems. The impact of a bleeding disorder is particularly severe on women due to their multiple roles and responsibilities. Women often come back from their workspace and almost immediately sometimes need to become homemakers, become tutors, become cooks, and whatnot. So these women need good, optimal musculoskeletal health to be able to fulfill their roles. There is a lot that needs to be done in terms of practice and research for women with bleeding disorders. There is very little literature available about musculoskeletal bleeds, their management, or sequelae amongst this particular group. Now, I've put up a picture here of Jhansi Ki Rani. She is a heroine from the Indian freedom fight, really. And you see there that she is actually fighting a battle against the British with her child tied on to her back. So I thought it was very symbolic of the kind of battles that generally women have to face every day, and more so in this particular group. And having a healthy musculoskeletal system can only make that battle a little bit easier in life for these women. So, what are the differences between musculoskeletal? What are the differences in the musculoskeletal system between the sexes? So, here you have two pictures. The first one pointing to the differences in the skeletal system between males and women and females. And you see, interestingly, there are also sex differences in the skeletal muscle and its traits itself. Briefly speaking, both of these basically put women's musculoskeletal system at a somewhat greater risk for injury and particularly bleeds even uh, just because of the way we are made. Some peculiar challenges faced by women with bleeding disorders are that this particular group often experiences longer diagnostic delay and encounter more challenges accessing care compared to men across the globe. As you all know, this is somewhat true of women and in women and women's health in general. And consequently, they suffer longer and often are isolated in their chronic pain, mobility issues, and daily life challenges. Again, this is something we are very familiar with as women, that we have societal pressure sometimes to be perfect. We don't often get enough time to be kind to ourselves. to give time to ourselves to heal, to rest. And this is often worsened by chronic pain if you suffer from some kind of pain problem, or if you have a mobility issue, and it almost, you know, multiplies your daily life's challenges. Along with this, remember these women, as we already are very familiar with, will have heavy menstrual bleeding and iron deficiency because of the inherent bleeding disorder. And this also affects their musculoskeletal health, as we will see in upcoming slides. So, what is the impact of bleeding episodes in joint and muscle health in women? Now, we are all familiar with the picture that is there on the right side of the screen here, where this is a very classic picture. You see the bleeding starting off in the joint, and as the blood accumulates in the joint swells up, it becomes warm to touch, it's very painful, movement will be restricted. Then eventually the blood which has left the blood vessel begins to break down, and the products of breakdown include hemosiderin and several pro-inflammatory agents, and these will affect the synovium, they will affect cartilage, they will affect bone, and cause a kind of destruction of these tissues, leading to damage in the joint in terms of chronic synovitis and hemathropathy eventually. Now, in a woman, added to this is the effect of heavy menstrual bleeding. Heavy menstrual bleeding will lead to lifestyle restrictions. Now, for example, in many Indian schools, women are not comfortable sometimes going to school because of a lack of toilets. And therefore, they will restrict their lifestyle very heavily if they have their period. Imagine a young girl or an adolescent with a bleeding disorder. This is going to be even more heavy. And with that, the lifestyle restrictions will lead to a certain element of physical deconditioning. The physical deconditioning will only add to this vicious cycle of joint damage, joint bleeding, and damage. The heavy menstrual bleeding will also lead to iron deficiency. Without the important hemoglobin in the blood, there will be reduced tissue oxygenation uh, due to this lack of iron, and this will cause lethargy, fatigue, joint pain, stiffness, and this in itself will lead to lifestyle restrictions, worsening this cycle. So, now that we've touched upon broadly the way the menstrual bleeding affects musculoskeletal health in women, what can we do to help minimize the sequelae of musculoskeletal bleeds and prevent them in this particular group? So, what are our goals of treatment? Our goals of treatment are mainly to prevent musculoskeletal bleeds, to minimize the sequelae of musculoskeletal bleeds, and treat the current bleed. Now, let's start off with talking briefly about treatment of the current MSK bleed. The treatment will basically be on-demand factor in our kind of scenario. Sometimes, if you're lucky, you might be on some low-dose prophylaxis. To prevent musculoskeletal bleeds, again, some patients are increasingly more fortunate in some states, in India particularly, to be able to be given emicizumab, and this will certainly change their lives. Regular exercise is also important to prevent musculoskeletal bleeds. Now, once a bleed actually happens and the acute bleed has resolved, then you need to work to minimize the sequelae of those bleeds. You don't want target joints. You don't want long-standing damage in the joint due to that particular bleed event. And that is achieved through physiotherapy, which will include components like muscle stimulation, exercises, sometimes ultrasound therapy, cryotherapy, etc. Plus, it is important to rest that particular limb in which the target joint is situated. So, you want to use orthotics or walking aids to minimize the loading on that joint in the case of a lower limb target, for example. And of course, lifestyle modifications. And in all these areas, the physiotherapist would be very important in coordinating treatment for musculoskeletal leads and their sequelae. So I would like to illustrate these main principles using a simple case study. This is the case of a young woman, we'll call her Mrs. P, 35 years of age, who has von Willebrand disease type 3 diagnosed at 10 years of age. She had a hysterectomy done at 25 years of age due to menorrhagia. She also, incidentally, is type 2 diabetic and had only access to on demand treatment with CFC. She has a supportive spouse and they adopted a little girl, so they have an adopted daughter. And she holds a clerical job in the local high courts, which involves a lot of typing. Because of this, she developed target elbows and was on long leave due to the inability to type. She had a very active lifestyle, lived her life to the fullest, wanted to live her life to the fullest. She did everything, work, in the courts, home chores, including cooking. She was a very spiritual person as well and enjoyed traveling to temples and such. So she was a very avid pilgrim traveler. Her musculoskeletal problems briefly were target elbows. She would have, when I first saw her, have almost 4 to 5 times of bleeding per week. And she had a grade 2 hematopathy in both the elbows with severe active range of motion restriction in the left elbow. I have mentioned the range here. And she had a weak right quadriceps muscle due to an old iliopsoas bleed. This is further increasing the weight bearing burden on her arms because the quadriceps is weak. She would have to use her hands to push off when she had to stand up. So here you see briefly her program, and you can see that on a timeline and sort of I put it, represented it through figures rather than sort of just explaining her clinical program out to you all. So she first accessed physiotherapy in April 2015, right? So we used initially a lot of kinesiotaping and soft elastic support for those elbows in particular, while seeing her regularly in clinic for over a period of 7 months. Initial months would be daily, then she would come about 3 times a week to clinic. Then we also included some functional exercises for her. And these she would do while, cooking. For example, you've got something on the fire, you can use the kitchen countertop and do some simple push-ups, for example. You're waiting for something to cook, or you're waiting for your help to finish cleaning the room, and you're perhaps standing there and overlooking it, and you can then do your biceps and triceps simple exercises, for example. So in this way, she had an in-clinic program. She gradually sort of transgressed onto a home-based exercise program, which was built into her schedule, which was prescribed. So she had specific things she needed to complete every week. She maintained a journal of that, and that she would share with me either during follow-up meetings or even on WhatsApp. And overall, she had a very good outcome. So by the first few months, of the first year, she had no bleeds in her elbows. She was able to lead a full life on her terms. And she even got a promotion following becoming quite well from a musculoskeletal point of view. And eventually, we only ever communicated through WhatsApp. She would send some videos and we would give some advice. And she became very capable of looking after her own problems on her own. So she was truly empowered by the time that journey ended with us. So these are a few pictures of her. So you see, there she is, and she's, performing some kind of ritual on steps, really big steps. So she's able to do that only because she's fit from her joint and muscles point of view. You see these elaborate arrangements in the prayer room. And for this, she needs her hands. Here, particularly, she was giving out, it's a kind of custom where you give certain particular auspicious items to several women. So she handed these out to almost 100 women that particular day. And she managed to do that fine with no factor support and with no bleeds. Here she's climbed down somewhere. It looks like a cave with her family, and she's absolutely fine. So, this is a great example of how working on your musculoskeletal health, in spite of having a bleeding disorder, systematically working on strength and function can actually help you lead a full life. So, the takeaway message from this talk is that one is we need to acknowledge that women with inherited bleeding disorders face significant joint and muscle problems, which is further complicated by the heavy menstrual bleeding and the related iron deficiencies. So, we need to begin to ask those questions when we see these women. Physical therapy should be part of the treatment plan for these women because it plays a crucial role in managing musculoskeletal challenges in this group. And an effective physical therapy treatment plan should consider the background, the lived experience, the culture, and the daily challenges faced by women with bleeding disorders. Here are a few references which you might find interesting. So, thank you so much for a patient listen. Thank you.